Hello, welcome to my channel. I'm so glad you stopped by. My name is Susie, and today I'm going to share with you what it's like to go through cataract surgery after years and years of wearing glasses. And this is my story. I'm not a doctor. I'm not an eye doctor or a surgeon. So if you have any questions regarding your own potential surgery, please direct it towards the professionals. I'm just a patient. And I was just going to share with you what it's like and what it has been like for me. And right now I'm wearing the glasses that I started with before I had the surgery. But I must say, it's certainly not the only pair of glasses I've ever had. Since in fact, I have had glasses, honestly, I have had glasses, since I was 5 years old. This is just a little sampling of a few of them. Okay, so, and I actually dropped one on the floor. So, hey, come with me while I pick it up. Anyway, and this one is broke because I was going to try to do something else with it, but it didn't work out. Anyway, back to the story. I'm so glad you stopped by. I hope you like it. If you do, please hit the subscribe button down below. Leave your comments. Please be respectful. I really appreciate that. So, since I was a child, I had found out that I needed glasses not until the 5th grade. But anyway, wore glasses ever since. And was determined to be legally blind. And then when I turned 40, I developed astigmatism and dry eye syndrome as I hit menopause. So this may be something you're familiar with or not, I don't know. But anyways, to combat all of that, I've also had my fair share, I must say, of eye drops and eyelid cleaners. This is particularly a pretty good one. I don't know if it shows backwards on your screen, but it's OcuSoft, and it's for eyelid cleaning. And then more recently, and probably for the rest of my life, I will be using a lubricant. I've had many suggestions, but that's the one I'm using now. Okay, so on March 31st, I had my right eye done. Right? The lens that was chosen for me was the multifocal Toric 2 intraocular lens. And the reason it was chosen, and that was for both eyes, and sometimes you can mix and match, I guess, but for me, that one was chosen because of the astigmatism. It better corrects the astigmatism, which is the curvature on the outside of your iris. Okay, not the lens itself, but the iris itself. Okay, and inside they removed the amber lens. It had turned amber, right? Of course, I did not realize that it was so deeply amber until after I was looking through a new eye, basically. And then they put in that lens. So it's a fairly simple operation. The surgeons were amazing. I had this done in Lacey, Washington, in case anyone wants to know. You can ask me private message or something if you want to know who. But anyway, I'm not trying to plug any particular surgeons or doctors or places. So that went relatively smoothly, and the next morning I was noticing some flickering, and this is on the edge of the lens where it's not yet healed up, and there's a little tiny incision they make, and the light can leak in, and as you move your eye around, it catches the light from, say, the window or the television, and you can see this little flickering. That is not unusual, nothing to panic about. However, since I had nothing to compare it to, I called them and they had me come in and check it just in case, and that turned out to be perfectly normal. It takes time for that to heal up, sometimes up to a few months. So they say, oh, within a couple of days you're seeing fine. Well, yes, your sight should improve. However, there are the little healing things that are going on. There could be inflammation, a little swelling, and you might see these little flickers or flashes. If it gets to be too much, or if you see a whole lot of floaters happening, that's when you definitely want to give a call into the surgeon's office and get looked at, and just to make sure that everything's okay and healing up perfectly well. Okay, so that's just a little tidbit. We had it looked at just in case. Now, on April 7th, we went ahead and did the second eye and chose, of course, the same exact lens. Not always the case. Sometimes one eye is different than the other, and another lens will work better in another eye. So discuss this with your doctor. Don't take my word for any lens, because the only lens that I have an experience with is the ones I have. Okay? And I did an awful lot of research, and you can do this too, on the internet and asking questions, of course, and everything. Ooh, pretty blue jay out there. I can see. Anyway, and this eye, unfortunately, gave me quite the scare, because when I woke up the next morning, it had hemorrhaged, and there was like blood pooling around the eye. It did not go into the iris, so that was good. They checked it, it was fine, and that can happen. So I just want to let you know that that's a possibility as well. It's rare, as are the other side effects, and I'll discuss all of those things with you. Now let's get on to what the sight was like. I'm going to pause this, and I'll make a second video for that, okay? All right, be back in a minute.